My job is just to make sure that, number one, we focus on customer care from the time that we answer the phone calls when patients call in, whether it's a new patient or an existing patient, making sure that patients get seen on time, making sure that any problems that occur during the day that, we take care of them. Of course, help the staff, just anything that we need to be efficient is my job. I love working for Dr. Davis because, one, he's just a great dentist. I have been in dentistry for, 20 years now. So he is really like the first doctor that I've ever worked for that I really enjoy because of his big personality. He really has a focus on taking care of the patients, and that's what I like. And I think patients like that as well. That's why they've been coming back to him for so many years. A lot of the patients sort of feel like that this is their home and, feel like family. He has like patients who've been here since they were like little kids. The staff is treated like family, as well, not just by the patients, but by Dr. Davis too. So it's just a great environment, to be in. So that's why I really enjoy working here. For me, customer service is a really big thing. I'm a consumer, I'm a patient, so I essentially like to run Dr. Davis's office as if I was a patient. So it is really important that when my front desk answers the phone, that we answer it in a polite manner. We're very professional. We try to service our patients as best we can. If we can accommodate the patient, we will accommodate them. And then in the office as well, we want to make sure, again, that customer service is just the number one focus. So that's what I usually get praised on, and that's what I want to make sure that we have. But on top of that, also providing the best dental care, too, for the patients, because they can go anywhere else, in Laurel. So I want to make sure that we sort of separate ourselves from the rest. For a patient to make their experience more pleasurable coming to the office is, one, not to wait when they're in pain. I usually say if you come in pain, you're going to leave in pain, because at this point your tooth is already mad at you. And so then they're going to get mad at us for irritating it, even more. So the biggest thing is not to put off dental work, to come in and make sure that they're coming for their every 6 months for their checkup. But also, if they know that they need work done, maybe a previous dentist told them that they needed that work done, to not put it off. So that's the first thing. Two, I think the second complaint is that everybody wants to know about finances. So the biggest thing is to know your insurance. We want to pull that information, for the patient, of course, so that way they know what to expect when they're coming in. But we gotta have something, too. So just knowing the insurance definitely helps us to help them. And I think those would be the only two tips I would say, yeah.